Audio recording for this meeting has begun.
Good afternoon, everyone, and thank you for joining us for Et al., the NCSD Journal Club. My name is Leandra Lacey, and I'm the Capacity Building Manager for the National Coalition of STD Directors. NCSD's Journal Club serves to keep you updated on recent STD literature while also encouraging you to think about literature's implications for your STD programs wherever you are. This webinar is being recorded, and the recording will be made available to you all within 2 weeks of this presentation. If you are not speaking, I ask that your phone line or computer speaker is muted. You should all be muted at once right now, so you shouldn't have issues there. If you have questions or need technical help during this call, please utilize the chat function in the bottom right-hand corner of your screen. You can also private message me, Leandra Lacey, or my colleague, Tiffany Haskell, who is listed as a host right underneath my name on your screen. All questions will be addressed at the end, but we will keep a queue, so please send them our way as they come up. I also want to flag for you that there is a box called Files right underneath the attendees box. In this box, you will find the journal article that is presented today, so you can download and reference it. And today's slides are also listed in this box as well. For our agenda today, we will start with Dr. Meghan McCool-Myers. She'll be discussing her recent article from the Evaluation and Program Planning Journal called Implementing Condom Distribution Programs in the United States, Qualitative Insights from Program Planners. We will then move to Angela Vaughn's presentation regarding the KnoWyo Condom Distribution Initiative through the Wyoming Department of Health. And there'll also be plenty of time at the end for you all to ask questions for the presenters. So without further ado, I'd like to introduce our first speaker. Dr. Meghan McCool-Myers is an assistant professor at the Jane Fonda Center for Adolescent Reproductive Health at Emory University School of Medicine. Her research focuses on sexual and reproductive health of women and young adults. During her doctoral studies in Europe, she explored the epidemiology and care of female sexual dysfunctions. She also studied social marketing strategies for condom distribution in Europe and in the U.S., and is now implementing these proven strategies in Atlanta, Georgia. In light of Atlanta's escalating rates of sexually transmitted infections among young adult populations, novel condom distribution methods and expedited partner therapy for chlamydia and gonorrhea are two priorities of her research. So I'll go ahead and hand it over to you.
Great. Thank you so much, Leandra, for the introduction. I'm very happy to join the webinar today and talk a little bit more about some of the research we did at the Jane Fonda Center just last year, where we explored how different condom distribution programs are implemented and also maintained. So my interest in condoms and condom access actually started in Europe. So I lived in Europe for several years, and when you walk down the streets in large cities, you can find condom dispensers with a selection of products. They're not for free, but still they're readily available for anyone at any hour. What I also loved was the different posters and campaigns you might see in the metro or underground. They would have condoms on them, and you just couldn't miss it. They also had a condom campaign in Germany that I thought was pretty interesting, with bedroom scenes that looked like someone had just had sex, and then had slogans. For example, this one says, "Live out your fantasies, but don't risk getting AIDS." And this inspired me quite a bit as I came back to the States and began delving into condom distribution and condom access in Atlanta. So Atlanta is famous for a lot of reasons. Number one, for rap, but also for our soccer team that won the Major League Soccer Championship this year, and also for all the movies and series that are now made here. However, Atlanta is also famous for its extremely high rates of STIs and new HIV infections. In fact, the two counties that primarily make up Atlanta are both in the top 20 counties nationwide for STI rates. There are over 3,000 counties in the U.S., and we're in the very top percentile of that. Furthermore, while the U.S. has seen an overall decreasing trend in unplanned teen pregnancy rates, Georgia's rates still remain higher than the national average. So while we all know that great progress has been made in terms of effective prevention of HIV transmission through PrEP and ART, we also see an impact of more effective methods in contraception in reducing unplanned pregnancies. However, PrEP and IUDs and implants, they don't prevent STIs. And we still need condoms in all of these fields, not only for protection against STIs, but for those who can't access more effective methods of prevention of HIV and pregnancy. So at the JFC, we actually started exploring some commercial access to condoms in Atlanta. That was our starting point. What does condom access look like in our city? And we performed some field research in downtown Atlanta and found that 80% of stores lock up condoms. As you can see in this picture, the condoms are actually behind that gentleman behind a plexiglass screen. And in those stores, over 50% of them only offer one brand of condom, and that is a Trojan Magnum. We also explored free condom access in Atlanta, and when we looked at the condom distribution programs in these two counties that are particularly, where STIs are particularly prevalent, we found that there were no lists or maps of where you can get free condoms. Finally, we also spoke with community-based organizations in these counties, and we found that this quote pretty much summarized what a lot of our colleagues were saying, and that was, to be truthful, if I were not in HIV public health, I wouldn't see free condoms being dispensed either. Free condom distribution information is not being trickled down to the community like it should. I think we all know because we're in the field. So clearly Atlanta needs some changes, but before the Jane Fonda Center just tried to bust in and save the day with some fancy new condom distribution program, I wanted to understand what other programs are doing in the US and how it's working for them. And this is what inspired the current study and the publication that we're talking about today. So the objective of this qualitative study was to gather a variety of insights and experiences from planners across the US to inform effective implementation of condom distribution programs. How do we do this? Well, we used propulsive sampling to get a variety of types of programs across the US. So we wanted site-based, whether these were conventional or non-conventional sites. We wanted web-based, meaning individuals, not organizations, could order condoms for themselves online, and also any other novel means of distribution that we uncovered through our exploration or through snowballing. 17 CDPs were contacted up to 2 times, and 10 were recruited. We had a 14-question discussion guide with open-ended questions, and the conversations lasted around 30 minutes. They were performed over the phone by one interviewer using an iterative research approach. And shorthand notes were taken from the conversations and analyzed using grounded theory. We extracted the core themes from these conversations and aggregated the findings by theme and by topic. So let's delve into some of these results. We aim to get representation from all areas of the US, but as you can see, we actually didn't have representation from the West, which is great that we have KnoWyo from Wyoming on the call to give us some insight from that area of the country. But as you can see, the majority of programs targeted the general population, so 6 out of 10, followed by young adults. And they also primarily addressed city or county settings or jurisdictions, 2 addressed university campuses, and 1 was a statewide program. In terms of other characteristics, so we see that about half of the people that I spoke with were from departments or boards of health. The rest were a little bit mixed from marketing agencies and nonprofits. Most programs were about 5 to 9 years old. One that was more than 10 years old is, big surprise, New York City Condom. And the distribution channels were mixed between site-based, web-based, and one using a novel approach, which was through a partnership with Uber. The information we gathered through these phone calls and conversations with the 10 program planners brought 5 themes, or you could say categories, to light. The first one was identification of target population. Secondly, distribution channels. Third, type of condoms distributed, fourth, messaging and promotion, and finally, monitoring and evaluation. I'm going to walk through those in the next few slides. So identifying the target population. How did these programs choose who to reach out to? Well, generally it was either a top-down or a bottom-up approach. So 8 out of 10 used a top-down approach. That is, they identified areas of the city that had the highest rates of STIs or new HIV infections and then chose to focus their efforts there. They may have gone one step further and stratified the data according to certain demographics to determine that it was a certain population that they were trying to target. For example, 15 to 24-year-old Hispanic men, and then they would also adjust their strategy accordingly. One of the pros of a top-down approach is that you're able to really focus your efforts in specific areas. It decreases the amount of territory and people that your program has to cover. The con of this is that public health data is often not super current, and it's not real time, you could say, and it may be aggregated over several years, and it may not account for missing data or may be scaled up. Other programs used a bottom-up approach, and here it was the target population themselves that inspired the program's inception. So the first one was some students at Boston University said they didn't want to get condoms out of a bowl in front of an admin's desk. They wanted to have more discreet options. So the University Health Services used campus mail to deliver condoms to students living on campus. As you can see here in this picture, the project has grown into a very ripe project with social marketing, a monthly sex ed campaign, and much more. It's called the Condom Fairy. Maybe some of you have heard of it. The other bottom-up program was, again, inspired by students and a very forward-thinking Uber driver. So an Uber driver in Texas kept getting asked by students if he had condoms in his car. You know, sometimes they'll have snacks or water or something. And so he decided to go to the Board of Health, and they gave him baggies of condoms, just something really simple, plastic sandwich baggies with a variety of condoms and lube in them. He and other drivers now provide these condoms to university students during their Uber ride if they ask for them. The second theme is distribution channels, and we just heard about the Uber channel, so I want to talk more about site-based and web-based. With site-based distribution, these programs leveraged conventional sites, as we know, clinics, testing centers, community-based organizations, and they also leveraged non-conventional sites, so salons, barbershops, fitness studios, and so forth. All of these programs reported a growing number of sites each year. The greatest challenges that they emphasized in those interviews were restocking or keeping all of the products up to date, that they weren't expired. Also making sure that the condoms weren't placed in like direct sunlight or near too much moisture, so monitoring, but also creating maps or lists of the sites. That was also a challenge that some of the programs mentioned. We're going to hear a lot more about web-based distribution from Angela, so I'm not going to talk about it too much, but some of the recurring themes with this type of distribution were that they had very high demand and rapid growth. The clients also expressed that they were very satisfied with the convenience and the comfort of this type of distribution by receiving condoms by mail. Web-based distribution also offers a unique opportunity to track inventory, orders, even information about users, which we'll get into a little bit later. And yet some of the challenges related to web-based distribution would be like the IT aspects that can be a little bit difficult and the cost related to that. And also it's not ideal for spontaneous sex. So if we think about our high-risk populations, 15 to 24-year-olds, they may not plan several weeks in advance to get condoms. And so it may not be ideal for those scenarios. The third theme was types of condoms distributed. And all of the programs, all 10, said that variety was key. They primarily got their supplies from Total Access Group or Global Protection Corps. Several of the program planners that I spoke with reported difficulty accessing FC2s or internal condoms. And some of you on the call may know even more about this than I do, but as I understand, it's due to internal changes in the company and also their decision to make FC2s prescription only, which is really a discussion in and of itself. I have, however, included a contact in the appendix in these slides for someone at FC2 at Veru Health if you would like to reach out to her. But again, back to the programs. The programs said that it was important for them to, again, have variety, offer variety packs, as this encourages people to branch out from Trojan Magnums and maybe try a different brand. However, this is not to underestimate the importance of brand recognition. So brand selection or brand recognition is one of the primary contributing factors to condom acquisition and therefore ultimately condom use. So some of the programs used program branded condoms with these personalized foils, and this tends to get a mixed review amongst focus group research that has been done. There may be certain stigmas in populations related to rebranded condoms that they're of lower quality. And so what I saw were some innovative approaches to promote the condoms and also the program at the same time. So here you can see stickers that you could stick to the individual condoms, which is a pretty low-cost strategy. Also, condom folders is a solution that can be used, as well as here, New York City Condom, they integrated their logo together with Lifestyles or with One condoms. And this actually brings us to the topic of messaging and promotion. So the CDC specifies that a social marketing campaign is essential to an effective condom distribution program. Now, a campaign can look very different for each organization. It may have different components, but essentially you want to get the word out about the condoms and improve acceptance of condoms in your setting. Through our research, we found that 2 out of the 6 site-based programs did not have maps or lists of sites. The reasons behind this were that they didn't have enough staff or that they had technical issues with the map or with the website. Many of the programs described limited budgets specifically for condom promotion, that usually the funding was going towards HIV PrEP or towards testing, but there wasn't a designated budget for condoms. Some of the proactive sides that we saw, or proactive strategies we saw, is putting stickers on doors with site-based promotion and indicating that it was a safe space to pick up condoms. Also leveraging social media. That was very popular. Social media is much cheaper and more effective than print media, is what many have found. And it also, in a way, allows you to measure the impact of your program. Again, maybe not behavior, but you can at least see clicks, likes, shares, and responses, which is sometimes more than you're going to get from a store that's just dispensing condoms from a dispenser. Here, I just wanted to show an example of DC. So DC used Google Maps to create, to demonstrate where the sites are for picking up condoms. And this is actually a really easy approach that doesn't require, let's say, your cliche IT guy. All you need is an Excel sheet with the names and addresses, and you need Google, which I think everyone has. And these maps can be generated and then integrated into your website very easily, and also changed and adapted as you have new sites or if addresses change. So that's a solution that could be recommended for other sites who don't have a site or a list of where condoms are available. Also, when it comes to messaging and promotion, again, we heard that budgeting can be an issue. However, we see that with social marketing, you can go a long way on a very small budget. For example, Take Control Philly said, we only use social media, and every time we put up a post or an ad, they say around $15 per ad, the orders explode. So they do online distribution as well. And then this comment from Texas Wears Condoms was pretty amusing. They said, we put a $5 ad on Grindr and it literally broke our website. So as you can see, it doesn't require having a big marketing company or big marketing strategy necessarily. Those are nice to have, but if you don't have that right now or you don't have the funding, then there are other means to get the word out about your activities and what you're doing. This brings us also to the last topic, which is monitoring and evaluation. So this is obviously very key to any program. Ultimately, we have to prove that what we're doing is making an impact. So we ask planners exactly that question. how do you measure the effect of your condom distribution program? And what we found is that all 10 of the programs did monitor the number of condoms distributed and the sites where they distributed, as well as events and locations, for example. Some were able to do program awareness assessment and to capture that, but these types of studies tended to be expensive and or biased. For example, if you do a survey about your program awareness at a pride parade, your sample is not going to be representative of the general population anymore. So that also alludes to the fact that demographics are very difficult to capture for a condom distribution program. Who are the people who are emptying out the condom dispensers at that bar? We don't know. We can make guesses, but we just don't know. And as mentioned earlier, in regard to public health data, we can't really distinguish how our condom program specifically is affecting STI rates. Since the reporting isn't necessarily in real time, the data may be incomplete or scaled, and it's also heavily impacted by how clinical settings are reporting STI diagnoses, whether that is an automatic or a manual reporting system from the clinic. So some of the most exciting developments that I saw were with Texas Wears Condoms and the Condom Ferry. So in Texas, they do web-based delivery. So they delivered 30,000 condom packages in 2017. And of those 30,000 orders, 19,000 clients responded to their survey, and it was a pretty extensive survey as well. So that was a 63% response rate, which normally in email marketing, it's somewhere around 10 to 15%. So it was really exceptional response rate and very robust. And what they found out is that they were able to reach rural populations in Texas, 20% of their orders. Adolescent reach were 1 out of 5 of their orders. And also they discovered new things about Texas populations. They discovered pockets of low HIV awareness and high-risk behavior in Texas, which then allowed the DPH to focus their efforts specifically on that area or those jurisdictions in Texas. Also, the Condom Ferry program at Boston University had some interesting findings. So they did a before and after survey. You got a survey right at the time of ordering and then 4 weeks afterwards. And they found that 91% of students say it's easier to practice safer sex because of the program. 2/3 of the students said they make more responsible decisions because of the program. And 28% of students said that the Condom Ferry motivated them to go get tested. So you see that while they were just distributing condoms, they also were able to get information out about testing and motivate a large percentage of students to consider testing or to go and get tested. This brings me to my outlook or to discussion. And here I would really want to say provide like 2 take-home messages, I guess you can say. Number 1, I think that web-based distribution is really the future for 3 reasons, really. One of which is that you have discrete purchasing and delivery. And this is highly important for our high-risk populations, ages 15 to 24, who experience the most embarrassment during condom acquisition. And embarrassment can lead to not acquiring condoms at all. So we want to make it, we want to reduce those barriers as much as possible for this population. Also, 2/3 of young adults prefer to order products online rather than go in stores. And this isn't specific to sexual health products. This is just in general, they prefer to acquire products just online. Also, 8 out of 10 millennials never buy anything without first reading a review. And being able to shop online gives you a lot more time than standing in a store in front of a clerk and trying to understand which condom you want and at which price. From a monitoring and evaluation side of things, we saw that also web-based distribution allows you to capture demographic data, behavioral data, programmatic data, and also user preferences. It may allow you to also reach rural populations, adolescent populations, or other high-risk populations. However, I do want to note that web-based distribution may be the future, but site-based distribution is not to be thrown out the window. They have their relevance and they are great for spontaneous situations, as mentioned. However, it's highly important that we tell people where they can get condoms. Just like in Atlanta, if we don't tell a wide audience, if we aren't sharing this with a wider group of people, then only the people who use these services or the people who are in public health are going to be the ones who know where these locations are. My second take-home point would be that I think condom distribution is more important than ever before. So I know this is a bold statement, but I believe that it's true. Again, PrEP and long-acting contraceptives are awesome, but they don't protect against STIs. And we need to remind people of that because we find ourselves in a very unique and challenging time, all of us who are on this call. We have schools that may not let us teach comprehensive sex ed to sexually active teens. We have abstinence education and abstinence programs that are getting $10 million of funding. And also, particularly for the field that I'm in, abortion restrictions have the potential to severely limit young women's alternatives in the case of an unplanned pregnancy. So we, the members of the NCSD, we do have to carry the torch and make sure we're making every effort not just to distribute condoms, but also to educate and to advocate for condoms. To this end, I know that the NCSD has been promoting this through some of their messages, but I do want to again underline that there is a new STI federal action plan that is still open for public comment until June 3rd. So I would encourage all of you to make sure you take some time to voice your opinion on this, as it sets the precedent for how the money is allotted in the future. So maybe Leandra can say more about that, but again, I would encourage you to speak up as experts in the field. And with that, I would like to close and also thank the programs that were involved in our interviews and who agreed to let me share their information. So I'll pass it back.
Thanks so much, Megan. That was an awesome. Oh, thank you. That was awesome. Thank you so much. I will go ahead and move forward. And again, feel free to type your questions into the chat box. We'll address them all at the end, so just keep them coming. Oh, and these were your other contacts, right?
Correct. There are a couple of appendix slides that are there for folks to look at.
Perfect. And as I mentioned earlier as well, the slides are listed under the Files tab to the right of your screen, so if you need those contacts, you have them there in the slide deck. So I'll go ahead and move forward to Angela Vaughn's presentation. Angela is currently the Communicable Disease Prevention Program Manager at the Wyoming Department of Health. Previously to this role, Angela has had experience with both surveillance and communicable disease epidemiology. She obtained her master's in public health from Creighton University in 2016 and started work with the health department that same year. Currently, she is pursuing a doctorate in global health sciences. Angela is passionate about reaching and connecting directly with at-risk populations so they know what care is available to them in their communities. And take it away, Angela.
Thank you. Thanks, Leandra, very much. So as Leandra said, I am Angela Vaughn, and I work here at the Wyoming Department of Health. I'm going to talk to you a little bit today about our KnoWyo campaign, and it's not just directed towards condom distribution, but it's also a statewide marketing services program that we try to use to reach the entire population of Wyoming. Wyoming is a very rural and frontier state. We are a very large state as far as square feet goes, but we only have 500,000 people in the entire state. So we really want to make sure that we have resources available to everyone who is in those rural and frontier counties. So I'm just going to go over KnoWyo. It's not just condom distribution, as I said before, but it is a statewide marketing campaign. Condom distribution is a big part of KnoWyo, and it allows residents to know where they can get free condoms and also order free condoms on a Google form. It also gives a comprehensive list of our public health nursing offices in the state. And as a part of our voucher program, we partner with all of these offices to provide low and no cost testing for anybody who is uninsured or underinsured. We target people who engage in high-risk behavior, and we also do a lot of outreach and education with the residents of Wyoming. And we also provide education on STDs and comprehensive sex education curriculum we support as well. So this is what KnoWyo looks like. We have a lot of different links on KnoWyo, but we wanted it to be something pretty comprehensive as far as where people can go, that they're not being redirected or have to click through so many different pages to get where they want. So we want people to be able to educate themselves on STDs, know their risks, because a lot of people don't know their risks, be able to find a clinic where they can get their low or no-cost testing, order free condoms, and access PrEP, or HIV pre-exposure prophylaxis. But I'm just going to talk about the condom portion of KnoWyo today. So we do free condom mailers. That's one of our many methods of getting condoms out into the community. We do a simple Google form. Anybody can order free condoms on the site. And we don't ask for a ton of information, but on the Google form, we do ask their age range. So we have several age ranges that they can choose from. We do ask their gender, and then why they don't buy condoms. So we do collect all of the information on why they're ordering condoms through our website. So a few of those options are they don't want their parents to know. That's a big one that we see with our 15 to 19 population. They're too embarrassed. They don't know where to get them. They're too expensive, or they're not available near them. And we see that a lot, especially in these rural counties where they are miles and miles away from any condom dispenser, any store. They're not available. So we want to make sure that we can reach everybody within the state with this mailer program. So in the mailers, we send 10 condoms, 10 packets of personal lubricant, and a testing card that shows them that they can go to KnoWyo, and it's all in a discreet envelope. I'll show you the condom mailers as soon as I'm done with this slide. But we do allow them to kind of personalize these condom mailers. They can order non-latex, they can order magnums, they can order Trojans, or they can order crowns. So we offer those options for the people who do order these condom mailers. And anybody who wants them can order up to 4 a month. We do have to cap it at that because we have so many orders that we want to make sure that we're not sending hundreds to one person. And then we send them out once a week. So as Dr. McCool-Myers did say, this is kind of a barrier to those people who want to engage in spontaneous sexual activity. But we do get a lot of people who order these quite regularly, and we've had really great success with it. So here is the condom mailer and our free condom posters, which I'll talk about a little later. But as you can see, we have the discreet envelope, 10 packets of personal lubricant, 10 condoms, and then a testing card. And if you can zoom in, it says if you've received this but in error, you can call our number here. And a lot of people do call this number, parents of kids who might not want their parents to know that they ordered these. We do get these calls quite frequently, and we never disclose who ordered the mailer. We just say, we'll take you off the list, and then if that person wants to order at a later time, we can send them to general delivery. So we try to keep a running list of who we shouldn't be sending these condom mailers to and cross-check them as we send them out. And then another big way that we get condoms out into our state is our condom dispenser sites. So we provide condom dispensers to anyone who wants them, and I'll talk a little bit about that during our recruitment slide. But they're another huge way that we get free condoms out into the communities in Wyoming. We have a free condom locator tool on KnoWyo that allows them to either look at a map or a list that is comprehensive to the state. They can find their city and pick from a dispenser there and go and get as many condoms as they would like. And currently we have 403 dispensers throughout the state. So that's not sites, individual sites that have condom dispensers. That's how many dispensers that we have. So we have a casino that has about 20 large dispensers that they keep stocked. Most sites have 2 or more condom dispensers. They keep them in their restrooms and just let anybody who wants come in and get them. So how do people find them? As you can see, Wyoming is very rural. You can zoom into any of these pinpoints, and there's lots of sites on this map. but we want to make sure that people can zoom in to wherever they are and be able to access condom dispensers within their area. As you can see, there's a lot of dead space here, and that's not because we aren't trying to really push condom dispensers in those areas. It's just that this is a lot of vacant land, and people live on acres and acres and acres. So that's why we really wanted to make sure that you can order condoms online as well, because we know that we're not going to be able to get into all of this rural area, and there aren't a lot of people who can, there are a lot of people in Wyoming who might not be able to get to a dispenser. We also have a really great thing going on that we just started a couple weeks ago with KnoWyo, and it's a geofencing campaign. So anybody who is within 1 mile of a dispenser, if they're on Facebook or if they're on a website, will get served an ad that they are in a vicinity that they can get free condoms right now. So they can walk to that dispenser that they're closest to and get those condoms there. So we will have data on that shortly as soon as we see how many people are going to those sites and how often we're having to refill those. So our condom dispenser recruitment we are doing completely all throughout the year. So we rely so heavily on our partnership with public health nursing offices in all 23 of our counties in Wyoming. So how that works is I connect with every public health nursing office in the state and make sure that they have enough handouts for potential sites, make sure that they are kind of in their communities and know what sites might be the best to host a condom dispenser. So I do give out handouts, and they include all of my information for ordering. They include the size of dispensers that we can order. We order them from Total Access Group. And they also include a picture of the stand that we provide for our condoms and our Get Free Condom stickers that go on the dispensers as well. We have a KnoWyo sticker that we stick on all of the dispensers that allows people to know what, where they can get tested through KnoWyo in their county. And then we also include a disclaimer that tells them that they, as a site, do not incur any cost. We make sure that they know we cover the amount of the dispenser as well as the condoms to fill them, because a lot of people see the cost on the sheet and they're an immediate no. But we want to make sure that they know that they don't really incur any cost at all. So our public health nursing offices go out and they recruit target sites. We have a list here that shows exactly what types of sites that we like to recruit. But we do this as well. If we think of something that we want condom dispensers in, we can give them a call as well. But we rely so much on public health nursing because they know their communities more than anyone else. So a big one that we target is bars. There's a ton of bars that have our dispensers, tattoo parlors. We only have one university in Wyoming, but we do have a ton of community colleges, so that's definitely a target as well. We focus on drug and alcohol treatment centers, homeless shelters, fairgrounds, which we have a lot of, transitional homes, truck stops, campsites, casinos, schools, but we're a very rural state, so we have very few schools. I think we actually only have 2 right now. And then big events. We have an event called Cheyenne Frontier Days. It's the largest outdoor rodeo in the world. We really try to focus on getting condoms into those events as well. So the upkeep of dispensers. Public health nursing offices call and maintain relationships with these sites on a regular basis. And so they just call in, check in. They make sure that they know how to order condoms online. Our dispenser sites can go on to not KnoWyo, but a different website, and they can order condoms, whole boxes of condoms that we deliver right to their door. They can order condoms for sites that don't want to order online. A lot of our bars, they don't want to get online and order. So we can order them on our end and have them delivered to their door, or PHN can also order them. We can deliver them there, and then they can take them. And a lot of times they do that as well just to make sure that the dispensers are in good shape, because we don't want our branding on something that's broken or cracked. So we do want to make sure that we can replace the damaged ones so they always look nice. So here's some data on our condom distribution. It's really gone up in the last few years. I took over the condom distribution program in 2017, and everything that is ordered is all tracked by our office administration. So they tell everything that we're ordering, everything that we're sending out, exactly what counties they're going to, what dispenser sites are getting how many condoms, and they also track how many mailers we're sending out. So dispensers throughout the state has increased from 2015 from 102 to 403 and counting. We're getting new sites every single week, and we want to make sure that we can accommodate as many sites as we possibly can, because we know that Wyoming is rural, and we want to make sure that anybody can go out and get condoms if they need them. So here's some of our distribution data from the last 4 years as well. In 2015, there were 275,448 condoms sent out, and we didn't have data on mailers that year, and I'm not quite sure why. So that's something that I'll have to really dig up if we really want to see how many we sent out in mailers. But you can see that we've had a huge increase in mailer condoms. We started out with just 2,900 in 2016. Last year, we clocked 36,332 in mailers and 458,441 condoms distributed through our dispensers, through events, and through mailers total. So we're climbing. For only 500,000 people in the state. I'm very proud of that 458,000 condoms that we were able to distribute throughout the state. And hopefully we'll just keep growing and growing and growing. But we do have challenges, just with as with any program has challenges. So events are our biggest challenge. Cheyenne Frontier Days has been very hard to manage. We have our state population actually doubles when Cheyenne Frontier Days takes place. We have people from all over the world coming all the time to Cheyenne Frontier Days. It's the biggest outdoor rodeo in the world, and unfortunately, we want to make sure that we have a lot of condom distribution there, and some years it's great, and some years it can be really terrible. It's never consistent. We've bought dispensers. The next day we've had them ripped down, but then we can buy little shower baskets and fill, and they're a hit. So we really have a hard time navigating through events. Another big challenge is damage to dispensers. So that's why we like to have that open communication with each and every site that tells them that we can order you a replacement if somebody tears it down. We understand that these aren't reinforced metal, they're just plastic. So we know there's going to be damage, but we want them to know exactly who they can call when that is, if that dispenser is damaged, and how quick it can be there. And we also get a lot of resistance to dispensers. So we have a lot of sites that we would love to have a dispenser in, but like I said earlier, we have a very conservative community here in Wyoming. And so we do get pushback, we do get resistance, and all we do is educate, educate, educate. We try to keep a running list of people who we have approached in the past, and instead of offering them or pushing a dispenser, we ask instead if we can put up our free condom posters, just so they know that we're thinking of their patrons. If they need free condoms, they can order them online, or they can get them at a nearby site as well. So we always like to start with a poster, and then we do get people who see how much their patrons appreciate that and then want a dispenser in the future. So we try to meet everything with a little bit of education and a little bit of marketing as well. And we've also had a lot of really great successes. We have significantly increased our number of dispensers and condoms overall throughout the state in just the last 2 years, and we are having more initiatives than ever. So we want to make sure that we can exceed those numbers every single year and get more dispensers within the communities, and also work hard on getting those mailers out as well, because we know that our 15 to 21 population, they can't get in the bars to get a free dispenser. So we want to make sure that we give them as many options as possible. Another big success is strengthening our partnerships with public health nursing offices. We have a really great open line of communication with public health nursing in our state, and I've been very lucky to get to know a representative from each and every office, and we have really great communication now. We've also really increased knowledge about our distribution services. Before I started, not a lot of people knew about it, so I wanted to make sure that our ads focused on free condoms, where you can get them, where you can order them, and they know exactly who they can contact. Before last year, we had multiple counties that had one or no dispensers, and now we have dispensers in every single county, and it's growing, as I said earlier. And we really have a great ability to reach people with barriers in obtaining condoms with those condom mailers. We know that people wouldn't use a condom if they couldn't get them through those condom mailers, especially in those rural areas. If you don't have transportation, you're not going to walk 10 miles to a store to get condoms, and we know that. So we try to make it as accommodating as possible for our patients, and we've had really great success. So moving forward, we're going to continue advertising dispensers, our condom distribution. It takes a lot of work to do the mailers, but we try to get all hands on deck with those, trying to stuff them and get them out in the mail because it's a lot for our one office admin to handle, but we really want to make sure going forward we can grow this to as big as it really can be within Wyoming and make sure that our residents have as many options as possible. And that's all that I have for you on KnoWyo. It's a lot of data that I'm happy to pull those condom mailer data numbers as well and kind of convey what are the biggest barriers that we get on those mailer forms. If anybody would be interested in that, I'm happy to do so. But that's all that I have for you, and I'm happy to field any questions about KnoWyo.
Thanks, Angela. It was great to hear Megan's presentation about her article and the interviews that she did with condom distribution program planners, and to hear your side on the ground with how KnoWyo is working and the challenges and successes that you all have had. So that's awesome. Right now, we'll take questions. Feel free to type your question into the chat box in the bottom right-hand corner. We did get one earlier from Mike. He says, in addition to condom distribution, are any of the condom distribution programs providing education on how to achieve correct and consistent condom use? So Megan or Angela, have you seen any education around that, done any kind of promotion around correct and consistent condom use, maybe with KnoWyo, anything like that?
Yeah, so this is Angela. I will say that we do have a county right now who is rolling out a condom distribution program called Ready to Ride Wyoming, and it is essentially a mock of the Wrap It Up Alaska campaign. So every condom that is handed out, they're all made by Say It With a Condom, who did such a great job, but they come in a little insert, and they have kind of a funny little drawing on the front, but the inside of the insert tells exactly how to use a condom correctly and give some condom education. So that's kind of what we're doing on our end. As I said, I didn't include it in here because we're only rolling it out in one county right now, but so far it's been very successful, and I know that Wrap It Up Alaska has huge success with their condom distribution campaign, and they include a lot of education with every condom that they send out.
Just to continue on what Angela said, I've heard of similar successes with different programs. While we did not ask specifically about educational material that different programs are using in regard to correct and consistent condom use, some of the websites did offer additional information about condom use, how to use condoms, and so forth. But it really depended on how extensive the websites were. One of the things that, again, I think is really interesting about these programs and the opportunity is to extend beyond condom use to other topics such as STI testing or PrEP or even access to contraceptives. So I think there's a lot of also consent is a big theme that some of the programs are looking into now. So I think that there's a chance to provide education even beyond consistent condom use. But again, we didn't explore the education component explicitly in the publication.
Thanks for that. Yeah, I mean, of course, distributing the condoms is really important, but that educational piece is also important so people know the importance of using it correctly and consistently. So thank you so much for that question, Mike. Any other questions from participants? You can type it in the chat box. Oh, perfect. We have one from Jane Bowers. She says, for the individual condom mailers, what is the staffing for providing those mailers? In other words, who sends out the mailers and stuffs the envelopes with the condoms?
Thanks for the question, Jane. So again, this is Angela, and I will say that our office admin does most of that work. On the weeks that she's really busy or we have an abundance of condom mailer orders, we do take time, carve it out of our unit schedule, and try to get all hands on deck to stuff those. So she sends them all out on her own, and then if she needs additional help, she just reaches out. And we're at a point kind of right now where we can maintain it, but there have been weeks and sometimes months where we really all have to get together and do so. And as long as we can schedule a little condom stuffing party with the entire unit, we can usually get a lot of those out of the way pretty quickly.
Awesome. Thank you. I see Jane, you're still typing. Maybe she has a follow-up. Oh, perfect. She says thanks. I do have one question for you, Angela.
Yeah.
And Megan, you can also chime in, given your experience with speaking with those who plan these condom distribution programs. What's one piece of advice you would give a health department or other agency that wants to start a condom distribution program? Some people on the line, maybe they do have the programs going already, but maybe, they're looking for tips and suggestions for getting started. So what's one piece of advice you would give?
So I think the biggest piece of advice that I would give is just find local partners. We've really relied heavily on public health nursing, but we also have relied heavily on a lot of other just public entities, bars. Just make sure that you have those partners on the ground as well who can really make sure that they can help you. I know it seems like a lot of work, but when you have those partners, it really takes away from all of it. And I think that you can really get to more people with the more partners that you have.
I would echo exactly what Angela said. That was going to be my first response, especially when it comes to site-based distribution, is working with the sites that are going to be supportive, maybe starting in those jurisdictions or those areas or those bars that you think will be supportive or where you already have leads, and building it up from there. And from what I've heard, it tends to have sort of a domino effect that people say, oh, well, they're doing that at that bar, and so we want to do that too. And so the word starts to spread when it comes to site-based distribution. For web-based and starting that up, it is quite an endeavor, as you can see from Angela's numbers, that the growth was quite rapid. However, they still managed to get everything sent out on time despite the rapid growth. But I think being prepared for the fact that there could be very high demand is important when starting up a web-based distribution. I think also some of the challenges that I've seen with programs where they said, for example, okay, they can totally personalize the package. Every single condom can be picked out uniquely. That obviously creates more hurdles when trying to package up the condoms, and that it's better to take an approach where you have like a variety pack, like, okay, all of one kind, or these are all the tailored brands, or these are all the XL brands, and trying to use more of like a grouped approach rather than doing super individualized packaging, as that ends up taking more time. And I think that with web-based, also the IT aspect, again, there are a lot of places where you can set up e-commerce platforms that are conducive to this sort of, or you can use Google Forms, for example, as Angela was saying. There are really a lot of ways to do this at a low cost in terms of IT, but once it starts to get more advanced, or if you want to collect more data, that's where you're going to potentially need some additional support with data collection, confidentiality of that data, and so forth.
Thanks to both of you. That was really informative. Emily asked, on the mailing order survey, what do people primarily say is the reason for ordering the mailers? We have done a small survey and had embarrassment and cost as the main reported reasons.
Hi, Emily. So this is Angela, and our top two are also embarrassment and cost. The third is definitely don't want my parents to know. And then we do get a couple that condoms aren't available near me. So those, we definitely have those same two reported reasons. Embarrassment and cost are the highest, and then followed pretty closely by don't want my parents to know. And we get those from the younger crowd.
All right. Thanks, Angela, and thanks, Emily, for your question. Any other questions from those on the webinar? No, we have a few minutes left. I don't see anyone typing. I have one last question, if no one else does in the chat box. For you, Megan, what would you say is other research that is needed around condom distribution programs or condom distribution in general? You went over a lot of different challenges that those you interviewed brought up, such as monitoring evaluation being an issue, how to gather demographics, those kind of being some of the challenges. What are some other things you would say is needed for further exploration and research?
Well, yeah, I mean, certainly the aspect of evaluation, because that is in the end what funders are looking for, is did this make an impact? And when you look at some of the larger studies that have been done about the effectiveness of condom distribution programs, you get mixed results because, again, it's very, very difficult to capture this data. And so we're all constantly trying to prove ourselves and prove our program and that it's effective, and you need data to do so. But actually going one step back from that is you need funding to collect that data. And so, again, I think that's where a lot of the hurdles come into play. I know for myself, being more on the research side of things rather than in a Department of Health or Board of Health, on the research side of things, I've spoken with different funding bodies, and they say condoms aren't innovative. And that was a really frustrating thing for me to hear. People in the field of reproductive health or minority health or HIV to say condoms aren't innovative. And I think that we need to shift the dialogue a little bit and show innovative ways of distributing condoms, and to intrigue funders and show them that there are new ways and there are new channels that are going to help us reduce this very, very prevalent issue of STIs across the U.S. And so, yeah, I think funding is a big challenge that we run into being in the condom arena.
Thanks for that. And yeah, I understand where you're coming from with that, especially with our members being STD program managers. That's definitely something that we've also heard out in the field, that funding is often an issue, especially in more conservative jurisdictions. Emily says, in California, we've been working with other public health branches to do a statewide survey of retail stores to assess condom accessibility with the hope of potentially increasing condom availability in the community in general. Thanks, Emily. That's great work that you all are doing in California. Great initiative that you all have going there. It's really exciting, and will hopefully, like you said, increase condom availability to everybody. So that's awesome. Jane, I still see you typing. We'll let you finish before we wrap up. If you had anything. Okay, that's fine. So with that, I'd like to say thanks to all of you who've attended the Journal Club today. I've included the presenter's contact info in addition to mine on this slide that you see here. Once this webinar is closed, you will be redirected to just a brief webinar evaluation. Tiffany has also copied and pasted that link into the chat box, so you can access it there. Please complete it so that it can inform future Journal Club webinars. Today's recording and the slides will be sent out via email to all those who registered within 2 weeks of today. And be on the lookout for the blog related to this article in June, and then the next Journal Club meeting in July, which will be posted on NCSD's website and in our STD Weekly newsletter. So with that, I want to say have a great week, and thank you so much to our presenters today. Have a great day, everyone.
Bye. Thank you.
Bye.